Hey guys, I'm going to talk about healthcare in the UK today. So, healthcare in the UK and in Canada are quite similar, considering how much older the UK is. I am guessing Canada took our healthcare system from kind of how the UK does it. It's a bit different though. So, for example, in Toronto, I choose my own doctor. If a friend of mine says that she loves her doctor and he's like an hour away from my house, I can just go sign up with him if he's open to taking new patients. So one of the most frustrating parts about this whole British system of working is that you have to get a GP or your general practitioner slash family doctor that's in your area. So each postcode, which is also an odd thing, so everything in the UK is by postcode, which is like a postal code or a zip code. Um, Back in North America, if you were to ask somebody what's your postal code, nobody knows, but everybody here works on postcode. So, for example, I live in SE1 2AW, which is a postcode. SE1 means I'm in Southeast London, and the other three are just, I guess, it's the area of the block or whatever. So when I want to look for a doctor, I have to go on the NHS website, which is the National Healthcare System in the UK, and put in my postcode, and then it tells me which doctor's offices are in the area that I'm eligible to apply to be a patient at that are open to taking new patients. So even if there's no good doctors in my area, I'm stuck with them because I have to go with ones that are close to where I live, which is crazy because they're open like 9 to 5. Most people work during those hours, and not many people are lucky to, work right by where they live. So if you want to go to like a doctor's appointment at like, I don't know, 9 o'clock or at lunchtime, you gotta take like a whole day off or like half day off work just to come to the doctor's, which is a bit stupid. But yeah, there's no way around that. As far as I know, you can't just like go and want to sign up to a doctor that's near your office, for example. Um, Anyway, it's really frustrating. I called around actually, and there were like 3 or 4 places that I'm eligible to become a patient at. 2 of them weren't taking any new patients, and then one of them was like, "Oh yeah, we cover your street, but we only cover the buildings that are on the east side of that street. You live on the west side of that street, so we can't take you." It's like, but you cover my area, anyway, it's really frustrating. But yeah, having a GP or being signed up with a GP, even if you don't use them, is so critically important in the UK. Because, for example, I actually didn't have a GP up until about 2 weeks ago, and I've been here for a little over a year now. Um, Mostly because when I first got here, I moved here last April. I pretty much knew that I was going to move away from where I was living. And I was on a 6-month contract with my house. And if you move, you have to get a new GP anyway. So I figured I'll just get a new GP in my new area. Because my old area was just so remote and I couldn't get to anywhere anyway. So I was moving in October. In September, I had a kidney infection and didn't have a GP. So I didn't actually even know what was wrong with me. I was just having a lot of pain, so then painkillers for like 3 weeks in a row, and then I realized I probably should go to the doctor. So I ended up trying to go to a walk-in clinic, and they were saying, "Well, you don't have a GP, so we can't bill anybody. We can't bill your GP, so you can't come to the walk-in." And I was like, "Well, the whole point of coming to a walk-in is because I don't have a GP. If I had a GP, I'd just go to my GP. Why would I come to your walk-in?" And they're like, no, you need a GP so we can bill them. Otherwise, you can pay like £300 to see an NHS doctor. And I was like, I'll just go private then and just pay out of my own pocket. So I ended up going to the urgent care center at a hospital. The urgent care center is like the non-emergency emergency room at a hospital, and the emergency room is called A&E, which is accidents and emergency. So since I wasn't like, bleeding to death or something, I ended up just kind of limping my way into the urgent care center in one of the hospitals, waited around for like ever, got yelled at by like 8 different doctors about not having a GP. In the end, they treated me. They gave me antibiotics and everything. And that's all covered and free in the healthcare, but got a lot of shit for not having a GP. So yeah, I moved and then I just couldn't find one. And anyway, I finally have one now. But yeah, definitely once you sign up with the GP, then you get given an NHS number. So NHS, like I said, is a National Health Service, National Healthcare Service. Anyway, it's the healthcare governing body in the UK. You don't necessarily need an NHS number, but that's a number that you get given when you sign up with your first GP. And then if you move, you can just transfer GPs and you keep your NHS number. So under the NHS, most things are free, like they are in Canada. So checkups with doctors, most vaccinations, things like X-rays and scans, MRIs, and whatever. If they're from referrals, they should be covered under the healthcare because we're paying taxes out of our ass here and in Canada. Yeah, what is not covered? I'm not sure. I haven't had to pay for anything in the UK yet. I haven't paid for anything in Canada either, except, you know, like dental. Dental is partially covered in the UK, dun, 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 which is kind of crazy. Well, not crazy, it's kind of funny because you know how the rest of the world makes fun of British teeth, but they don't really have an excuse if dental's covered with your healthcare. So how dental is covered here is their services are divided into bands. So, for example, band 1 covers things like checkups, x-rays, cleaning, scaling, I don't know, minor fillings or something like that. And band 1 is like £18, which is like $25. And then band 2 is things like tooth extractions or maybe more complex fillings, I don't know, whatever, a few other things that are in that level. And it's like 40 or 50 pounds. And then band 3 is like 200 pounds, and I think it's more complex things like more surgical stuff like root canals or something. So obviously you can get NHS dentists or a private dentist. So if you have like insurance with your company, with your work, then you would probably choose to go to private, because the only problem with NHS doctors and dentists, questionable. I mean, some people say the quality versus private, but most people complain mostly about like scheduling. So it's impossible to get an appointment because, you know, there's like millions of people that live in the city and there's just not enough doctors and dentists. So you have to wait like 3 months for an appointment or something like that. Luckily, I live with my dentist / really good friend of mine. So anyway, so yeah, I think maybe whitening or more complex braces aren't covered or something, but most things for dental are covered here. So definitely take advantage of that if you come, especially from like Canada where checkups are like $300. I'm exaggerating, but you know what I mean. So yeah, another thing is prescriptions. So prescription stuff is obviously not covered under the healthcare in Canada. So if, let's say, I go with the prescription of antibiotics and toothpaste or something, and I go to the pharmacy, they'll charge me antibiotics $20, toothpaste $5, or whatever the things cost. Here, prescriptions are charged by the line item. So if your doctor wrote on a prescription pad, or for example, I haven't had any doctor prescriptions here yet, but my dentist / flatmate wrote some prescriptions for me for my teeth stuff. And, you know, if they were to, okay, for example, she prescribed me this extra fluoride toothpaste. Instead of writing toothpaste, and then let's say antibiotics, which would charge me by 4 line items, if you lump it into one line item, like 2 tubes of toothpaste and then antibiotics, you're being charged per line item, and it's like £7 something. So no matter what you're getting, and I'm pretty sure it's no matter what, it could be some exceptions here and there, but you just get charged per what the line item is. So if you get like antibiotics, 2 tubes of toothpaste, I don't know, some other allergy cream, pain medication, whatever it is, each line item is £7 whatever change, which ends up being really, really good if your drugs usually cost a lot of money. Birth control is completely free in the UK. They want to control the population. What else? Yeah, those are really useful to know. I noticed also when I went to the dentist to sign up for the first time, they ask you, it's like a little questionnaire, and they ask you like, what's your ethnicity background, and the options were like white British, white non-British, black non-British, black African, black Caribbean, Indian, Asian. And when they say Asian, they don't mean my Asian. They mean more like Middle Eastern Asian, Chinese, and other. I have never in my life been considered other. Back home, I would check off Asian or something, but I checked off other in my questionnaire, which was kind of odd. Back to GP. Yeah, so it's super important that you get a GP right away. The NHS website was saying something about if you're only here for a temporary amount of time, like 3 months or 6 months or something, you can still get a GP. So you don't have to be here for like a 2-year visa or have like proper documentation. Like when I went to my GP, nobody asked me for like my passport or my work visa or whatever. As long as you have proof of an address that you live somewhere with a photo ID, all is welcome in the NHS, which is good and bad. Good if you're on the receiving end of that. Bad if you're on the receiving end of a waiting list, because basically a lot of people from the rest of Europe that don't really even live here will get like an address in London, family, friend, or whatever, and just come to the UK for all their medical services, use the NHS, and then just go back home. So obviously, I don't know that for a fact, but this is kind of what a lot of people complain about and whatever. So that's partially apparently what's to blame for all the really long waiting lists for NHS doctors and dentists. What else is covered under the NHS? Quite a bit, actually. Anyway, if you're here, you can do the research and find out. But definitely, as soon as you get here, get a GP, sign up with one. Even if you don't use that particular GP, you need to be signed up with one so you can fill out forms and things like that. Yeah, I hope that was helpful. If you have any questions, let me know. Obviously, again, this is just my experience in the UK. I'm getting kind of some questions from people about like, what to do if they were to be moving from another country to London, or their visa situation or whatever. I'm sorry, I don't know. All I can kind of advise you on is things that I've gone through as a Canadian living in London, in the UK. So yeah, there are tons of information on the internet. Make sure you are doing your research though. So don't believe like one source. I think I was researching for a good like 6 months before moving here. Yeah, definitely really helpful if you do that. Anyway, that's it for me. I'll talk to you guys later. Bye.